Friends, today I am going to discuss about another important gynecological problem called adenomyosis. Adenomyosis often coexists with endometriosis. It is present in about 6 to 10% of the women of reproductive age. So most commonly it is found in the middle age women, that is 40 to 50 years of age. But nowadays even in adolescent girls and reproductive age women also adenomyosis can be present. So adenomyosis, those women who have repeated abortions or induced abortions or repeated dilatation and evacuations, that is DNCs or DNE or myomectomy or previous cesarean section, that is those who are having previous uterine surgeries, they are more prone to develop adenomyosis. So it is more common in multiparous lady. So what is adenomyosis? In which the uterus has two lining. The innermost lining is the endometrium and the outer lining is the middle lining is the myometrium. So if the endometrium or the inner lining of the uterus goes into the myometrium or the other lining, then it is called adenomyosis, in which few blood spots like or cysts are present in the myometrium or in the lining of the uterus. So how will you present? What are the signs and symptoms? The symptoms are patient will be having chronic pelvic pain, that is dull lower abdominal pain, severe dysmenorrhea, severe pain during menstruation. The third thing is menstrual irregularities, that is heavy menstrual flow or prolonged periods. Duration of flow is increased. These patients can also present with a low back ache. And so how can we reach at the diagnosis of adenomyosis? So ultrasound, it is good enough. About 70 to 85% cases of adenomyosis can be correctly diagnosed with ultrasonography. Generally a transvaginal ultrasonography is better than a transabdominal ultrasonography, in which you can present a diffuse enlargement of the uterus, a globular uterus. Uterus is bulky in size. There are some cysts present in the myometrium. The junctional zone of the myometrium of the uterus is increased. Normally it becomes more than 12 mm and there is a thickening of the posterior wall of the uterus. So some other thing is MRI can be done. If the ultrasound is inconclusive, so we are not able to reach at a diagnosis with ultrasonography, MRI can be done. It is quite costly, but it is more sensitive and specific than ultrasound for diagnosis adenomyosis. Hysteroscopy also has a small role in diagnosis. So what is the treatment? How to treat? So previously hysterectomy, that is the removal of the uterus, was the definitive treatment of adenomyosis. Especially it can be done in women, those who are having their family completed and they are no longer desirous of fertility. So hysterectomy is the definitive cure, but few medications can be tried. So these medications provide only temporary symptomatic relief for the pain and for heavy menstrual flow. So these medications can be given which control bleeding or which control severe dysmenorrhea or painful menstruation. Nowadays some levonorgestrel containing intrauterine system is available, intrauterine device is available in different names like Mirena or Emireli or Emily. So these can be put and these can control bleeding and adenomyosis. And endometrial resection by means of a transcervical resection of endometrium or roller ball. So these can also be used, but they are not available at all the centers. Likewise, uterine artery embolization, it can be tried. Uterine artery embolization is an established treatment for the treatment of fibroids or benign uterine lesions, but in endometriosis also it can be tried. And high intensity focused ultrasonography, it can also be tried. And the last resort is hysterectomy, and often it is present in the middle aged women, that is 40 to 50 years of age, by which time they have generally completed their family. So uterus can be removed So don't be afraid, meet your doctor and get an ultrasound done. Be happy. Bye bye.